I work for a pediatrician, and every day we have parents come in with their children to get checkups. The parents have to decide whether or not they're going to get their children vaccinated. Some parents are very willing and they just agree to get vaccinations. Some parents are more hesitant. They say, let's spread out our vaccines, and then eventually the children will get completely vaccinated. And some parents are unwilling to get their child vaccinated. We had a mom come in, and she told us that she wanted her child just to get the tetanus vaccine and not the MMR or chickenpox, and she'd come back later for those ones. She wanted to spread them out. Well, she took her family down to Disneyland, and her child contracted measles while she was down there. In 2015, there was an outbreak at Disneyland of the measles. They think someone from a different country was carrying the measles virus and spread it around. And that year, in 2015, we had 159 cases of measles. Whereas the CDC in 2000 came out and said that measles has been eliminated in the United States. The reason why it did not stay eliminated was because parents had decided not to get their children vaccinated for the measles or other vaccinations. Now we know that measles is not eliminated in the United States, and the way we get that is by herded immunity. We need to make sure that all of our parents are immunizing their children, and the ones that cannot get vaccinated will be protected. When I was 4 years old, my grandma died of cervical cancer. She did not get to go to one of her daughter's weddings. She didn't get to meet a lot of her grandchildren or her great-grandchildren. In 2006, there was a vaccination called Gardasil or HPV that protects against cervical cancer. If only my grandma would have had this vaccination, she'd still be with us today. If it would have came out just when she was a young girl, we could still have her around. This vaccine helps prevent abnormal cells growing around the cervix and the anus. It's available for boys and girls. Boys can get it to help prevent from warts and anal cancer, and also help not spread this to other girls. It's 3 shots, and you can get it in between 11 and 26. It is so important to get it early. The earlier, the better. The less likely you are contacted with these things that can cause cervical cancer. We need to make sure that we are vaccinating all of our children to help protect those that cannot get vaccinated and create this herded immunity to help protect people to be healthy and to save lives. And how do we do this? We do this by first looking at ourselves and saying, are we vaccinated? And we need to make sure we're vaccinated. And then we need to take our children and get our children vaccinated. This includes the flu shot each year. A lot of people don't like getting the flu shot. They say that the flu shot gave them the flu. For most people, the flu is an illness of a week, and you're deathly ill and you can't go to work. But for some people, this really does mean death. The Center of Disease Control came out and stated that in 2015, 55,000 people died from the flu. That is way too many people to die from the flu when we have a vaccination. Childtrends.org said that in the United States, 78% of our children are being vaccinated. That is not enough. That means that 22% of our children are not vaccinated. That does not help us get herded immunity, and it does not help keep our children safe. Getting vaccinated does mean saving us from death. It is the difference between life and death. The NIFD.org stated, in the U.S., vaccine-preventable infections kill more individually individuals annually than HIV or AIDS, breast cancer, or traffic accidents. 50,000 adults die each year from vaccine-preventable diseases in the U.S. 50,000 people die because they are not vaccinated. They could have lived. As the old commercial said from Gardasil, be one less. Let's be one less and get vaccinated.